I have chosen Norma Washington, that open-ended case study. Included, I have an S-bar and a care plan, but I would like to treat this like giving a report to a nurse. It makes me feel a little more comfortable. I've seen that a lot of times, and I've even had to do it myself. So here we go. Norma Washington, 84-year-old woman, found living alone with little food, disoriented, malnourished, and confused. When she got here, she was claiming she was seeing bugs. She was admitted to the medical surgical unit where she was evaluated, and once it was determined that she wasn't medically fit, Norma Washington was transferred to the psychiatric unit Monday. She has a history of chronic renal failure and dementia. She has no near family and a son that lives over 300 miles away that she sees once a year. She had a temp of 99.2, her heart rate was 100, her respirations were 20, her BP was 156/80, and on room air, her oxygen saturation was 92. Since she's gotten here, she's had a bit of a decreased appetite. She hasn't wanted to eat much. I tried to feed her. She ate about 25% and then wouldn't have any more. Her lab values, she has an elevated BUN of 56, decreased albumin of 2.8, elevated potassium of 7.1, elevated creatinine of 5.4, and a decreased sodium 124. Her extremities are warm and dry. I don't think she's taking care of herself correctly at home, causing her poor hygiene and malnutrition. I'm worried about her potassium level being elevated because that can cause heart issues, and I'm also worried about the patient's safety because of her confusion. I recommended to the doctor running IV fluids to prevent dehydration and lowering the BUN level. I also recommended a special diet high in protein to lower BUN and increase albumin and low in potassium. I recommended implementing a fluid restriction to prevent hyponatremia, and I recommended implementing a fall risk status. So they did order fluid restrictions to 1,200 mLs per 24 hours. She has a nutrition consult, case management consult. She takes lactulose 30 milliliters by mouth daily, losartan 25 milligrams twice daily, furosemide 10 milligrams daily, and alprolizam 0.125 milligrams as needed every 6 hours. She ambulates with a one-person assist. We showered her today. She did mainly everything herself. I did have to wash her hair for her. I did call the son for consent about the dialysis treatment. And he says that he is on his way here to see her now. So the care plan that I have created, risk for injury related to hallucinations as evidenced by confusion and disorientation upon admission. The goal here is that she will maintain a low level of agitation at a level that is manageable, so that she does not become a danger to herself or others. Assess leveling of anxiety. Assess her level of anxiety and behaviors that indicate her anxiety level is either increasing or decreasing. Recognizing these behaviors, we may be able to intervene before any violence occurs or any endangerment to her safety occurs. I want to promote her safety. I want to remove anything hazardous that she can get and hurt herself or anything like that. I don't want to create any more further disorientation or confused state, just in case she picks something up or anything like that and she could harm us or herself. I want to make sure she stays calm and reassure her when she does get agitated or confused, and having the son here might help that a little bit. Maintaining a calm manner with her, attempting to prevent anything frightening or anything unnecessary, and continually reassure her and provide support for her. As an evaluation, I want her to make sure that her caregivers are able to verbalize behaviors and that indicate an increasing in her anxiety level. We want to know when she starts getting anxious so that we can act right away. And ways that may assist her to manage the anxiety before things get out of hand. So recognizing these behaviors will keep her safe, and we will get her closer and closer to discharge and being able to go wherever the son decides, and we will talk to him more about that when he gets here. Do you have any questions? Okay, thank you so much. There is your report.